There have been major changes to the way we look at healthcare over the last 10 years that would have been difficult to imagine. For example, now, virtual doctor visits are considered to be as common as in-office visits. Tracking certain types of biomarkers, which used to be obtained through traditional clinical laboratories, is becoming commonplace for many people who track certain types of biomarkers from devices worn on their wrist, and conversations about general wellness now center on not just treating illness but also improving the quality of life by making various lifestyle changes. The underlying factor driving the changes mentioned above is a growing number of entrepreneurs, who are constantly evolving healthcare systems by taking existing healthcare systems and redesigning them in such a way that is practical and beneficial to all stakeholders. Many of these entrepreneurs are thinking about solutions to issues of access, trust, and long-term outcomes, rather than just trying to make a quick buck. Their businesses solve issues related to rising costs, lack of providers, and fragmentation of care, and this is resulting in both patients and providers looking for alternatives. The solutions that many of these impact-driven entrepreneurs are proposing will ultimately change how we provide and receive healthcare by integrating technology, prevention, and a focus on people into one model. A healthcare system at a crossroads. The healthcare system in America today is not only under great stress, but also faces many obstacles to successful delivery of service. The patient experience in America typically includes numerous providers and specialists, several laboratory services, multiple insurance policies, and fragmented medical records. In addition, millions of people live in remote areas and have limited or no access to basic healthcare. People may not have access to the level of expertise needed to treat their condition. Rather, they may have access to only limited services due to these barriers. As a result, the healthcare delivery system is being further pressured to create a comprehensive care plan for the aging population, a growing number of patients living with chronic diseases, and to meet the needs of the growing number of professionals in the healthcare workforce who are suffering from high levels of stress and burnout. Innovators entering into the healthcare arena are addressing these issues by questioning the traditional model of care. Is it possible for healthcare systems to be designed to help prevent the onset of illness, rather than to be a reactive one? Can technology help to prepare clinicians for their profession and provide them with the necessary tools and resources to perform their jobs effectively, without adding excessive work to an already packed workday? Businesses and entrepreneurs are creating new and innovative solutions to address these challenges, with an emphasis on building a more sustainable, inclusive, and impactful healthcare delivery system. Telemedicine becomes foundational. Telemedicine has emerged as one of the most visible outcomes of this shift. Once viewed primarily as a convenience feature, virtual care is now an essential component of healthcare delivery. Patients rely on it for routine check-ins, mental health services, chronic condition management, and specialist consultations that would otherwise require long travel times. The most effective telemedicine platforms are evolving beyond video calls. They integrate diagnostic testing, secure data sharing, and continuous monitoring to create a more complete picture of patient health. This allows providers to intervene earlier, adjust treatment plans dynamically, and maintain continuity over time. Telemedicine has also proven critical in addressing geographic disparities. Rural communities, underserved urban areas, and regions with limited specialist availability have benefited from virtual access to care. When implemented thoughtfully, telemedicine does more than increase convenience, it expands capacity and equity. Prevention and longevity take center stage alongside telemedicine. Preventive and longevity-focused care has gained momentum. Advances in diagnostics and analytics now allow clinicians to identify health risks years before symptoms appear. Patients, increasingly engaged in their own health data, are seeking guidance that goes beyond annual checkups. This approach reframes health as a long-term investment. Instead of episodic treatment, care becomes continuous, adaptive, and personalized. Lifestyle factors, genetic data, and clinical markers are considered together, creating a more holistic understanding of individual health trajectories. Entrepreneurs building in this space emphasize that longevity is not a single intervention. It is a system that requires coordination, accountability, and clinical oversight. Within industry conversations, Basta is often cited as one example of founders contributing to this broader movement toward preventive, technology-enabled care models that prioritize long-term outcomes over short-term fixes. Technology with purpose. Healthcare innovation is often associated with cutting-edge technology, from artificial intelligence to automation and advanced analytics. Yet many impact-driven founders argue that technology alone is not the solution. Without structure and governance, new tools can increase complexity and erode trust. The prevailing mindset among experienced healthcare entrepreneurs treats technology as an enabler. AI supports pattern recognition and data synthesis, but clinical judgment remains central. Automation reduces administrative burden, but patient safety and compliance guide implementation. This disciplined approach reflects lessons learned from earlier waves of digital health innovation. Healthcare organizations now prioritize tools that integrate seamlessly into workflows, improve decision-making, and respect regulatory boundaries. Innovation succeeds when it simplifies care rather than complicating it. Designing for scale without compromise. Scaling healthcare ventures presents challenges distinct from other industries. Growth must align with regulatory requirements, clinical standards, and patient trust. Unlike consumer technology, healthcare cannot afford to sacrifice reliability for speed. Entrepreneurs who succeed in this environment design systems that scale responsibly. They invest early in governance, build teams capable of independent decision-making, and create processes that maintain quality as operations expand. The focus is on building organizations that endure rather than chasing rapid but fragile growth. Within discussions about scalable healthcare infrastructure, William Basta is frequently referenced for advocating systems-first thinking, emphasizing prevention, ethical alignment, and operational clarity as prerequisites for sustainable expansion. Global health and the expansion of access. Impact-driven healthcare entrepreneurship increasingly extends beyond national borders. Telemedicine, at-home diagnostics, and modular care models make it possible to reach populations previously excluded from consistent healthcare access. However, expanding globally introduces complexity. Effective solutions must account for cultural norms, local infrastructure, and economic realities. Entrepreneurs working in global health often collaborate with local clinicians, community leaders, and policymakers to adapt care models rather than impose them. The most promising initiatives aim to replicate quality without replicating inefficiency. They focus on building adaptable frameworks that maintain clinical standards while responding to local needs. In doing so, they demonstrate how technology-enabled care can support global health equity when guided by thoughtful design. Trust as the core currency. Trust remains the defining currency of healthcare. Patients entrust providers with sensitive data, personal decisions, and long-term well-being. Any venture operating in this space must earn and maintain that trust. Entrepreneurs recognize that transparency, accountability, and ethical alignment are not optional. Clear communication, data protection, and clinical oversight are foundational. Ventures that prioritize these principles are more likely to achieve lasting impact. This emphasis on trust also shapes leadership approaches. Many founders now focus on building organizations that function reliably without constant founder involvement. Leadership becomes less about visibility and more about creating systems that support consistent, high-quality care. Persistent challenges in health entrepreneurship. Despite progress, significant challenges remain. Regulatory frameworks vary widely and evolve slowly. Reimbursement models often lag behind preventive and virtual care innovations. Data interoperability continues to hinder seamless coordination between providers. Additionally, skepticism persists among stakeholders wary of commercialization in healthcare. Entrepreneurs must balance innovation with respect for existing institutions and professional standards. Building credibility takes time, partnerships, and a willingness to engage constructively with critics. These challenges reinforce the importance of long-term thinking. Healthcare ventures rarely succeed through rapid iteration alone. They require patience, resilience, and a commitment to continuous improvement. A shift toward integrated care systems. Looking forward, healthcare appears poised for deeper integration. Telemedicine, diagnostics, and continuous monitoring are increasingly interconnected. Preventive care models are gaining acceptance as evidence of their effectiveness grows. Technology is becoming less visible, embedded within systems that simply function better. Impact-driven entrepreneurs are likely to lead this next phase. Their emphasis on coherence, ethics, and scalability aligns with what healthcare demands as it evolves. Rather than pursuing headlines, they focus on building infrastructure that improves outcomes quietly and consistently. Within this broader narrative, William Basta represents one of many contributors shaping a future where healthcare systems are designed around people, not processes. His work reflects a collective movement toward care models that value prevention, accountability, and long-term value creation. As healthcare continues to adapt, the success of these ventures will be measured not by hype, but by healthier populations, more resilient systems, and improved access across communities. The industry's future belongs to those willing to build patiently, responsibly, and with impact at the core.